go ahead with panel discussion for today. And so the topic of the discussion is issues and challenges in handling emerging and pre-emerging infectious agents like SARS-CoV-2. The panel will be moderated by Professor Dr. Lim Yang Mui. And may I please take the pleasure of introducing her briefly to all of you. In 2013, Professor Lim attended the Advanced Training in Biorisk Management organized by the Biosecurity Engagement Program. She received the International Federation Biosafety Association Professional Certification, both in Biorisk Management and Biosecurity, and registered biosafety professional from Malaysian Biosafety and Biosecurity Association in 2017. As the second president for the MBBA, she successfully organized the Malaysian Advanced Biosafety Officer Training Workshop for 3 consecutive times, and revised the training program for research institutes, universities, and government agencies. She then established a team of trainers and resource persons for MBBA that continued the effort to conduct biosafety and biosecurity trainings in Malaysia, as well as in Southeast Asia. She was the assistant secretary and the current treasurer for the Asia Pacific Biosafety Association. Since 2013, she has trained 80 MABOT trainees, conducted 16 workshops on biorisk management and biosecurity with more than 450 local participants and 250 international participants. She received the professional certificate as HRDC certified training on 4th March 2021. With this, may I please invite Dr. Yang and give her the stage to introduce the panelists to all of you. You need to unmute, Dr. Lim.
Yeah, thanks, Niti. Thanks for the kind introductions, and I'm happy to have these sessions to meet all of us here again, and for our trainees. I hope all of you have learned so much and enjoyed these sessions with all the speakers for the past couple of days. Right, so now we are moving on to these panel discussions, and this particular forums or these discussion sessions are more focused on the issues and also challenges pertaining to handling the emerging and also re-emerging infectious agents, such like the SARS-CoV-2. I think everybody know about all this, and we have gone through together up to this stage. All right, so without further delaying, now I would like to hand over these sessions to Dr. Asad to brief us on the contents of these discussions. Dr. Asad, over to you. Dr. Asad, can you hear us?
He can hear us. He has shared his screen, but he's not talking yet. So you need to unmute if you're trying to say something.
Probably having some technical problem.
Dr. Asad? Let me just read.
Oh,
yeah.
Sorry.
Okay. No
Sorry for the delay. Yes. Thank you very much, Dr. Niti, and thank you, Dr. Yang Moi. My responsibility is actually to bring the session in order. And after that, again, I will go back to our experts, panelists, and also Dr. Yang Moi. Yes, I have designed the objectives in the way that I will introduce the issues, and then another objective is to explain the challenges and to discuss how to mitigate the challenges. Yes, issues. Issues are sample collection in a kind of pandemic or in a kind of outbreak. Okay, the issues are sample collection. Issues are sample transportation, specimens handling in laboratories, conducting diagnosis, and disposal of waste. What are the challenges? Challenges are always like that. Training of the specimen collectors, availability of transport space, availability of appropriate specimen collection devices, training of the training of specimens packaging transportation, availability of packaging and transportation, transport media. Sorry for the mistake. Training on safe handling of specimens, availability of required personal protective equipment and containment label for handling specimens in laboratories, availability and selection of appropriate confirmatory diagnostic tools and consideration of culture-free disease diagnosis. And final challenge, availability of waste treatment and packaging materials and availability of proper disposal system. Okay, so I will again discuss about these challenges one by one. Number one was training on specimen collection, availability of appropriate specimen collection devices. Okay, so this is always a problem, how to collect the specimen. And you know that in case of the COVID-19 situation, so we are supposed to collect the sample. I mean, in respiratory, I mean the samples and the sample collection devices. What happened? I can give you the example of the Bangladesh situation. So the appropriate sample collection device was, I mean, depleted from the entire country within 1 week after we started the collection of the COVID sample. Okay, so we need nasopharyngeal sample, we need oropharyngeal sample. Instead of that, we were collecting nasal sample. So this was a kind of challenge we faced in Bangladesh at that time. And also here you see here, though during the sample collection, this was a kind of ideal situation, but also what happened in some cases, I mean, the patient were sitting back to back, okay, without any gap. So this was again a big problem for sample collection in Bangladesh. So two problems I can mention here clearly: the system and also the collection device, appropriate collection device was missing. And training of the specimens packaging and transportation, availability of the packaging and transportation medium. Okay, suppose I mean the transportation medium, what kind of medium we will be using for that? Is it normal saline? Is it viral transport medium? So these were a kind of big problem. And how to package the sample? Okay, so initially we were, in some cases, the samples were, I mean, transported in its, I mean, the primary container in a kind of package. And then we recommended that no, these samples will be transported in a kind of Ziploc bag. Okay, and the bag should be transported in this kind of, I mean, the tertiary package, and this should be brought to the laboratory, I mean, safely. So all these kind of problems we faced during this COVID-19 situation. And then after coming to the lab, so what should you do after coming to the lab? So this was again a big challenge. Okay, we were receiving different kinds of reports from different laboratories. Okay, so what we recommended, the sample will come in this kind of tertiary package, and immediately after opening the lid, we will spray disinfectant inside, and then take out the bag, take it inside the biosafety cabinet. Okay, and then what kind of laboratory we should be using? Should we be using a BSL-3 lab for this purpose, or a BSL-3 lab with BSL-3 practice would be enough for this kind of, I mean, situation for handling this kind of outbreak samples? Okay, so this is the risk group 3 and what kind of facility we will be using. Whether we are going for isolating the virus, or we are going for a kind of analysis, diagnosis without the isolating the virus directly from the sample. And that's the reason we used to consider, I mean, whether we are considering for the culture-free disease diagnosis. Culture-free means we are not increasing the number without, I mean, with culture. Okay, we are not increasing the number. So if it is an outbreak of bacteria, any kind of infectious bacteria, okay, we used to grow the bacteria, we increase the number and we go for, identification of the strain, we go for, antibiogram, okay. And if it is virus, then what we are going to do? In case of bacteria, whether it is possible to go for, culture-free disease diagnosis. Without culturing, we can diagnose the disease, okay. Suppose real-time PCR, any antigen-based testing, okay. So these are the considerations. And then finally, the challenge is waste management. One situation in Bangladesh was that we were not prepared for this kind of pandemic. And what happened? The stock of biohazard bag was completely depleted, okay. Then immediately we had to open the, the factory, and overnight they had to produce large number of biohazard bags and to send to those bags to the sample collector in different areas of Bangladesh, okay. And we have one waste treatment facility. Excuse me. What happened? Initially, they were panicked whether they will continue to handle, the samples coming out from the corona testing lab, samples coming out from the PCR laboratories. So they were asking repeatedly whether they should continue with the same procedure, with the same system, or they should stop working, or what they will do to manage this kind of waste. So this was a big challenge. And I think many of our colleagues in different countries, we also face the same challenge. Proper packaging material, proper disposal way. It was a big crisis immediately after we started the testing in our labs. And yes, the mitigation measure. The mitigation measure, yes, definitely select appropriate biosafety, biosecurity guidelines and standards for the facility and for the work, okay. And what we have CDC NIH guideline, we have WHO guidelines, we have ISO standards, and maybe we also have the national guidelines, okay. And WHO immediately published the interim guidelines. CDC NIH also published the interim guidelines for the COVID-19 sample handling, okay. And also to implementation of the biosafety biosecurity program, following that guideline is actually the main thing to mitigate is the main mitigation measure. And for that, what we need, we have to have the biosafety officer, we have to have the institutional biosafety committee to implement the biosafety program, we have to have the biosafety biosecurity program manual, okay. We need annual refresher training. In case of COVID-19, what I can give you the example is that during the COVID-19 situation, I had to organize the training for the entire organization in my organization, okay. So many of them, they participated in biosafety training. So we have to customize the training, those who are going for field activities. Now the problem is the coronavirus is out there in the field. Even though they are not, dealing with viral sample, they are going to different household for collecting some kind of data. But we had to organize biosafety training for them also in that kind of situation. So what we need to mitigate as a mitigation measure is the training, okay. Waste management program, specific training for the waste handlers, okay. And also we need safety audit and inspection, monitoring and continuous improvement of the program based on the safety audit and inspection. Yes, regarding the guidelines, we have the 6th edition of the biosafety in microbiological and biomedical laboratories. We have the 4th edition of the WHO biosafety manual. We have COVID-19 interim guideline for coronavirus disease 2019. We also have the similar one from WHO. Right now we have the ISO 35001 standard for biorisk management. So these are the guidelines, and following the guidelines, we can develop and implement we can implement the biosafety biosecurity program in our facilities. We need the biosafety officer, and biosafety officer will be the key person, will be the ex officio member of the institutional biosafety committee, who will be managing the institutional biosafety committee activities. And then again, biosafety officer will be developing the biosafety program manual. Okay, and the program manual will be the kind of the book for the institutional biosafety biosecurity program for the entire organization. And then, yes, the institutional biosafety committee biosafety officer will also be designing the annual refresher training, refresher training. In our case, we have annual training, refresher training. We also have the orientation. So this kind of different kinds of training should be there for implementation. We should have the waste management program, specific training for handling waste. For the laboratorians who are generating waste, we have to have the training for them. For the waste handlers, we have to have the training. Okay, and safety audit, annual safety audit and inspection. With this, I will hand over to Dr. Yang Moi and also our panel members to continue make comments and discussion on yes, issues and challenges in handling emerging, re-emerging infectious agents like coronavirus. Thank you very much.
Thank you, Dr. Arshad, for the though quite brief, but it's very comprehensive for us to refer and to start our discussions on the issue and challenges in handling the emerging and also re-emerging infectious agents. Yeah, and our focus would like to will be the SARS-CoV-2. Yeah, thank you so much, Dr. Arshad. And now I would like to invite and introduce our panel here, our experts. First, may I invite Dr. Pragya Yadav from ICMR, National Institute of Virology, Departments of Health Research, MOHFW. Dr. Pragya, can you turn on your webcam, and now we can let our trainees to know you. And let's move on. I'd like to invite Dr. Harina Rayana Rao, the scientific advisor. Hi, yeah, scientific advisor, BSL-3 laboratory for Ministry of Hyderabad. Hi, Dr. Rao.
Hi, good evening, everyone.
Good. And may we have Dr. Rajan Chakrabatti, former Vice President. From
hello,
the biology.
everyone.
Yeah. Hello.
Hello.
Good. United States Pharmacopoeia India PVT Ltd, yeah, the company, right? And then we move on to Dr. Ravi Sekar Gadipali from the Department of Microbiology, AIMS, Jaipur.
Yeah, I'm here. Thank you. Thanks for that.
Thank you. Nice meeting you. And we have Dr. Muhammad Ghiasuddin, former Director, National Reference Laboratory of Avian Influenza and consultant, and as well as the head of Animal Health Divisions, BLRI. All right. Are you here with us? Dr. Ghiasuddin?
Not yet, Dr. Lim. So
okay, if not, then we move
proceed.
on.
Yeah.
Okay, good. And let's move on. And we have Dr. Natasha, the Associate Director of the Operations High Containment Core, Georgia State University, Atlanta, US. Hi, Natasha.
Hello.
Nice meeting you.
Thank you. Nice meeting you as well.
Yes, nice meeting. And last but not least, our dear Dr. Asad Galgani, also on the panel. All right. So what we're going to do is actually bring out the discussion of one by one. So all panelists, you are invited to share your, your thoughts, your suggestions, whatsoever that pertaining to the issues and so challenges in handling the emerging and so re-emerging infectious agents. So roughly you have 4 minutes to share your thoughts and also whatever that you like to talk about, about this topic. So to begin with, may I have Dr. Natasha to kickstart the discussions first, and the rest of panel, you can come in to give your point of view. Yeah,
Sure.
Over to
Hello,
you.
everyone. And thank you very much again for having me participate in this meeting. So yes, I agree with Dr. Assad. There are many issues that came up with the current pandemic. And I'm sorry to say, but we have seen some of these issues during Ebola outbreak of 2014 to 2016. And I would love to say that we learned some lessons during that time, but unfortunately, SARS-CoV-2 pandemic has shown us that there are many, we did learn some, but there are many more lessons we need to learn. And I do agree that, the supplies are always an issue. We have ran very similar to what Dr. Assad was saying in the United States, we have ran out of a lot of supplies. Initially, personal protective equipment was a big issue. We had people that did not have proper personal protective equipment, which shut down some of the, ability to respond. And so we had to kind of backtrack and all of that and try to find some of that. But also on the laboratory side, we have opened our doors to try to manage some of the samples that were coming for testing and help with collection of those samples. And the problem with collection of samples that we ran into very early on with what were different swabs that were used. We realized that some swabs used were better than others. The transport media was a problem, obviously, as Dr. Assad pointed out, because you want to make sure you have the right media so that you get the viable samples back to the lab. And I think one thing that in general I have been seeing when it comes to responding to emergency, any reemergence or emergence of infectious disease, was the lack of communication at times between people collecting the sample and laboratory. And that's very, very important. I have happened to be in a field, and if I don't have instructions from the lab and I don't know how they want to receive their sample and what type of testing they have available, which will influence how do I collect that sample and how I preserve it to go to the lab, is important. I think some way of finding a solution to transport samples more efficiently. The packaging of the samples right now that we have available is extremely expensive and not very easy to find. So things like that, it would be very, very useful to have some way to, in case of a pandemic, to move those samples and be able to assist each other with processing the samples and things like that. Because, I think what we've seen with SARS-CoV-2 is that things happened in waves. So we had, at least in the US, we had a wave that hit where we got very overwhelmed and we could have used some assistance. And then we kind of went down into a valley where we had a little bit more time to recover and, before the next peak. And so I think that's something as well, how do we ensure that we have a continuity of operations when things like SARS-CoV-2 happen, when we are in a, global pandemic. And what we didn't really think about is that, when the pandemic started, a lot of borders were shut, a lot of exchange of goods and materials were stopped. So, if you run out of materials and you need them from somebody else, it was very difficult and sometimes actually impossible to get those materials. So I think that's also something that's important to mention. And, you know, sharing, I think having a platform where we can share our mistakes in a way that nobody gets necessarily, you know, punished or you know, a black mark, but actually we can safely say, here's what we tried, here's what we found out, it didn't work, don't make the same mistakes. I think that would be important, because different seems to me that different from hearing from different colleagues around the world that, you know, some of us had issues and we ran into same issues, but there was no way to share lessons learned. And I think having ability to share lessons learned from some of the mistakes we made could be very, very beneficial and help all of us prepare for, you know, something else that might be coming our way. I think, unfortunately, you know, it's not good that we have a SARS-CoV-2 pandemic, but I think this was a very good exercise for, you know, something that might come, that might be worse. You know, we had opportunity to hopefully learn from what was happening during the initial stages of the pandemic, and even now when we are kind of getting our getting to return to somewhat more normal operations and more normal lives. But again, like I said, I think we need to be able to share collectively our lessons learned and learn from what's been going on, so we don't make the same mistakes next time, if there is a next time. Thank you. Over to you.
Thank you, Natasha. Very good points. Yeah, altogether we have 5 points from you talking about the issues in handling the SARS-CoV-2 during the pandemic, and you also give us, you know, suggestions that we should have a platform for us to discuss about all this. Yeah, lesson learned. Thank you so much. Let's move on to other panels. Do you have any view on this? Panel, volunteer, you can share. Dr. Yadav, Dr. Rao, Dr. Chakrabatti. Are you here with us? Yes.
Yeah, we are.
Yeah, go ahead, Dr. Chakrabatti.
Yeah, I think I will. Yeah, I will raise 2-3 points what we have done that time. First was we were actually collaborating with a group on developing a detection kit. You know, the early days, a lot of companies were working on developing detection kit. So during that time, it was very important to figure it out, what kind of laboratory environment, what kind of training of the people you require. And at least in India, we got a lot of help from government, the RCGM, and also our individual institutional biosafety committee, because the committee members are like, we have our committee members from CCMV and other places who already have an established RT-PCR testing lab. So we got help from there. And that helped us to set up the whole laboratory and also the experimental procedure for the development of the kit. As far as I was at USP that time, from USP we have done multiple work. It's mostly on the US, started at US and then moved to the other parts of the world. First was with respect to the sanitizer and other different reagents which generally are used during that infection. You know, there were initially a lot of issues on the standard of these particular products. There were a lot of methanol contamination, all that. So USP quickly developed some standards that how a sanitizer should be, and accordingly, that standard was distributed free of cost to all the people in the healthcare profession. Then another, that is one step ahead. Once the vaccine came into the field, initial stage, you all know, there were a lot of issues with respect to proper transport of the vaccine, how we can efficiently deliver the vaccine so that there is a minimal loss, because initial stages, there was huge loss during the transportation and also during the injection. So USP immediately developed multiple standards on, we call it as a toolkit, on how to efficiently handle the vaccines with respect to transporting the vaccine, then using the syringe and needles with minimum point volume, and post that how you can dispose all those materials. And that has significantly helped in US to increase the efficiency of the vaccination among healthcare professionals. Then we bring it to India, and we have a couple of meetings where we kind of explain that to the users in India and also in Bangladesh with the DGDA. And I think that also helped our regions to minimize the wastage of the vaccine. So these are few areas where we have worked, and we know from the feedback we got from healthcare professionals that it really helps. So I think it is important also to know how you can maintain the standard and then efficiently do the testing, because we also have a standard for how to do properly validate the RT-PCR test. So all those we have given it free of cost. Generally in USP, you have to buy the USP NF to get all those standards. But during the pandemic, we made everything free, and so that people can use them and quickly develop their process. The same thing we did now recently with the vaccine. We have come up with a quality assessment toolkit where we have come up with toolkits for different vaccine classes. And on specific classes, we have come up with a list of critical quality attributes, how you can test those quality attributes, and where you can get those methods, both at USP or WHO or EP. And we have already distributed that to the regulators in developing countries like Africa, Southeast Asia, and Pacific regions. And we are also continuing to do that across the group. So that's all from my end.
Thank you, Dr. Chakrabatti, for your inputs, mainly talking about the vaccines and also detection kits, as well as the sanitizer, which is very important in the first place when we face all these problems. Yeah, one of the measures that we need to do. Thank you so much. And now can we move on to another panel?
Dr. Yang?
Yes.
Dr. Yang, we have Dr. Giasuddin now with us. So
yes.
Yes, so please consider him also. Earlier, he wasn't not there.
Sure. We invite all panelists to share their points, their view with us. Yeah. So anyone can go ahead, please. Yes, go ahead, Dr. Giasuddin.
Dr. Giasuddin, yes. This is, I have internet problem, so I joined somewhat later, actually.
No worries.
Actually, thank you very much for providing me the opportunity. Actually, the biosecurity, biosafety is, and this issue is now actually the most of the peoples, it is become clear to them because COVID situations make us more cautious about the biosafety and biosecurity. And our laboratory, Bangladesh Livestock Research Institute, last year we provide lots of, we diagnosed a huge sample, about 50,000 samples in our laboratory. But we observed that from field level, while samples come to us, COVID sample mostly, it is the quality of the samples is not up to the mark to handle safely in the laboratory, because those peoples who are actually collecting samples, they are not well trained initially, and they are not well marked the sample ID. For that reason, sometimes it confused in laboratory peoples for proper diagnosis. Along with, we observed that they are not properly kept the tube. For that reason, sometimes we observe that most of the samples actually they are leaking, and also sometimes we observe the many tubes there is no samples. For that reason, actually, when we actually collect these samples, or the collector of samples, they need to training at least the how they collect safely, and when they send to the laboratory personnel, their safety also important if contaminated samples come or the soil sample come. And preservation also we observed is not up to the mark. But now it is improving, day by day improving. So continuous training, biosafety training, biosecurity training is needed for those people who are actually directly engaged with the infectious materials. Thank you. I will talk now. Thank you. Over to you. Thank you.
Thank you so much, Dr. Yashadin. So you have highlighted very important points here, which is training. And that's where, we have this professional biosafety advanced training for our trainees today on pertaining to biosafety or biosecurity management. Thank you so much. Training is definitely a must for enhancing the efficiency in handling all types of infectious agents. Thank you so much.
Thank you.
Good. Yeah. Let's move on. Dr. Raut, are you here with us? Or Dr. Ravi Shekhar? Gadipali? Yes. Please go ahead.
Since I'm working in a clinical organization, I would like to share my experiences with the COVID-19. Our institute is the central institute for the training of COVID-19, as well as giving the approval for the COVID-19 testing for both Gujarat as well as Rajasthan states. And during the COVID-19 pandemic, we have given around 160 both the primary medical colleges as well as the government medical colleges as well as the private medical colleges and some of the institutes as well as some of the laboratories for COVID-19 testing. And ICMR has done a remarkable work after during the initial stage of this COVID-19. They have tried to establish these and strengthen these laboratories for viral laboratory testing, and they have initiated and they have selected some of the central institutes, and they have given not making that as a central authority of ICMR. They have given some of the approval authorities to some of the institutes like us. And across the country, around 21 institutes were selected at that time, and they have given the approval authority to and they have given approval to after seeing their lab structure as well as the personnel who are working under. And we have also given our responsibility is to make them make the working of that lab, as well as to train those people, either personally asking them to visit our place or making them available for their nearest lab in their vicinity which is available, and making them available for their QC samples. First, we will ask them to get the QC samples and to run those QC samples. If they could able to run those QC samples and they could able to send us the raw data, we will analyze the raw data and we will see if their QC is working fine or not. Then we used to give them the samples, and then we used to give them the approval authority from AIMS as well as from the ICMR. So these are the things which we have done, and we have also continuously doing since from the COVID, that is ILQC, that is inter-laboratory quality control testing for this COVID-19 from different laboratories, both in Rajasthan as well as Gujarat. And till now, we have done 1,70,000 tests for this COVID-19, both in first wave as well as in the second wave. And we are also part of the Central Rapid Response Team. The thing Dr. Asad has covered mostly all the points for the what are the lacunae and what are these challenges which we have to come across for this this kind of pandemic. Since there are some other emerging as well as re-emerging infectious diseases which can be imposing challenges in the future era, which we are going to come across. So I could say that in our system, we are also the part of the Central Rapid Response Team, where we are in that Central Rapid Response Team. They have selected one microbiologist and one person from the public health, that is from the community medicine, and another person is from the general medicine. So all three people will visit different locations where the outbreak has happened, or otherwise the number of cases are increasing. So we used to visit, government used to send these teams to the certain places where infection rate is more. So we used to go there and we used to check. One used to, the microbiologist used to check the laboratory, and public health person used to visit the nearest localities where the outbreaks are happened. And medicine person particularly used to visit the nearest hospitals and the wards, and they used to take care of the hospital healthcare system, how it is working and how they are maintaining. And the microbiologist main role is to see the lab as well as the how the hospital is processing the biomedical waste management, which is the most important part of this COVID-19 scenario. So we used to, we have in the team. I have visited the Ahmedabad in Gujarat, and we went to the largest civil hospitals in Ahmedabad, and we have gone through the different containment areas also, and we have given the containment plans, and we have given the rules for the house quarantine for the people who are affected, and we have also given the regulations from the ICMR for how to make the quarantine regulations. Either it is a house quarantine or it is a facility quarantine, and how to treat the persons who are in the ICU, and how to make the this healthcare system more appreciable to the public, so that the transportation of the samples can be easily be done to the nearest vicinity COVID-19 centers. So in this way, we have participated in the COVID-19 scenario. Thank you.
Thank you, Dr. Gedipali, on your. All right, so I think there's an echo. All right, no, now there's now okay. Right, so what he just mentioned to us is a very good point as well. When it comes to massive samples, 10,000 more than that, how should we handle it well, effectively, mainly related to those well-trained manpower that can handle all these massive samples. And of course, for the massive data that we're going to collect and ensure the QC quality has to be there before we get the right authority to approve it. This is very good. Another point that we have to really take into considerations to draft up those measures for the future's preparations. And of course, related to massive data, then we would like to have this rapid test, whether it's actually, again, the issue of effectiveness. So that is another lesson that we should taking care of as well. And some of the rules and regulations and the implementations of quarantines, for how many days and things like that. So these are very good points that raised up by Dr. Gedipali. Thank you so much. All right, so let us move on again to another panels. Dr. Rao, are you here with us?
Are you calling me Hari Rao or?
Oh, okay.
Okay,
they are two.
Okay.
Sorry,
Yeah.
they are.
Everyone. I really want to emphasize on a couple of things. In this era of emerging and re-emerging infectious diseases, thanks to epidemiologists, virologists, we could identify the root cause or the signs. So with the result, we are reasonably aware of the signs, but the limitations I always feel is the non-availability of functional containment laboratories. Because it's easy to identify in a research lab, but when it comes to application, we need quite a few. India has also gone through this crisis of non-availability of functional BSL-3s last year, but thanks to the central government input, we do have many more. As we develop it, of course, it is a time-consuming thing, and that lack of time or the lag time can sometimes create delays in developing drugs and vaccines. To prepare for the future, because as we talk about during this workshop on bioterrorism, re-emerging infectious diseases. My take is yes, WHO and CDCSO has come out with guidelines. Every country has to look at it, adopt, have a regional committee, and then make guidelines available in the local languages if it's necessary, so that it goes down to the people at the base level, at the field level. They need to understand. A book of WHO and CDC sitting in the computers may not be there at the local level. We should have an emphasis on converting these guidelines into the local languages, because most often English may not be the only common language. And then the second point I say is, yes, a country realized that they need BSL-3 facilities or even high containment facilities. Tomorrow, like a BSL-4, if it is an unknown disease for which we have theoretically no treatment now. So they need to have a clear guidelines, how to set up, how to certify, and make a uniform monitoring across the nation. Unless there is uniformity, in a hurry to make facilities, over enthusiasm can sometimes concentrate these viral loads and then create another thing that what we suspect that is the root cause for present COVID confusions. Having done that, we need to have, it's not the buildings that make the research, we need to have manpower. And when we have manpower, that is the biggest challenge. Facilities can be brought in no time, or even the containment facilities, what we call quicker time. But then one is a resource crunch, other one is an intellectual crunch. So we should have training courses to work in high containment areas, both for science as well as engineering. So the manpower development, science is not alone can help. There would be service facilities to back up as far as the exhaust and as far as the environmental safety is concerned. So we need to develop the engineering controls and engineering standards, and a thorough manuals needs to be prepared. So in my view, it's a preparedness that will help us to combat particularly these emerging infectious diseases. A, by having a good laboratories. B, having a local guidelines. C, have the science. And then it's good some universities can start at least a certification courses or some kind of either in virology or microbiology or epidemiology backgrounds, some I don't say workshop, some kind of classroom teaching of containment facilities, which was only till now is confined to the higher laboratories. Probably till about 5-6 years back, we only have 2 in this country. We talk about NIV, we talk about HSDL Gwalior, but today it has become a common word. So my thought processes are preparedness in terms of lab generation, in terms of manpower. Hopefully this pandemic will give us a kind of a caution or a kick on our back so that we all be ready for tomorrow to facilitate a faster and a quicker drug discovery programs. Thank you so much.
Thank you, Dr. Rao. Thank you so much. Yeah, you have just summarized it, yeah, before you end your sharing. But I would like to, echo what you have just mentioned. One of the very important point here is that if that particular country or that location do not have that level kind of lab facility, so how should one handle it? Yeah, for example, like if they say we need BSL-4, but we don't have it. So what are the things that we should put in place to help those countries or places that they do not have this facility? Yeah, very good point. Yeah, thank you so much, Dr. Rao. And good, yes. And now can we invite or have Dr. Asad? Any thought of yours that could share with us? Dr. Asad, yeah.
Yes, I think our colleagues nicely explained everything, and I do not have anything to add more with that. And thank you very much. And Natasha is still here with us. If you are interested to add a few more in conclusion at the end, that would be very nice. I want to take the opportunity.
I am still here, and yes, I couldn't agree more with all the issues and concerns that have been raised, and some solutions that have been implemented. Like I said, I think it's important that we share and learn from each other. I do agree that I can speak from the first-hand experience. When you don't have facilities that you need, and you are, in the middle of an outbreak or a pandemic, like we have seen with Ebola and like we are seeing now with SARS, you have to improvise. You have to figure out a way. Just because we don't have enough facilities, unfortunately, our work does not stop. We cannot just sit there and not do anything. So in my experience, it all comes back again to the very much to the importance of being able to do that real-time risk assessment and know what you have available to you, understand what you are up against, and be able to protect yourself and your team the best way you can and still help and do work. Training is a huge component, and we mentioned a lot of training that's been going on over Zoom and over computers because we can't really travel and do much. But I am a big believer in, going and doing in-person training and showing people how to do something, walking them through the steps, watching them how they go through the steps and correcting as that happens. I think that's crucial. So developing some way of training, not only online but in person as well, and developing those training networks where we can share PowerPoint presentations. I mean, I don't know, whatever it might be, so not everybody's wasting their time redoing something that some of us might already have and be available. I think is important, which is going back to being able to share some of our lessons learned, resources would be wonderful. So it's been enlightening session, and I'm very grateful to be part of it. So thank you again very, very much. And I really hope we continue to do this in the future. Hopefully not because we have a pandemic, but hopefully because we want to be better prepared. So thank you very much. Over to you, Dr. Assad.
Thank you.
Dr. Yang and Dr. Assad, I need to mention this. We have Dr. Pragya Yadav with us.
Okay. Yes, Dr.
Yes,
Pragya.
please.
Yeah. Dr. Pragya from BSL 4 facility.
Dr. Pragya, if you could hear us, yes.
I think Dr. Pragya, you got to unmute yourself.
Yeah. Good evening, everyone. I'm very glad to be part of this discussion.
Yes. So, Dr. Pragya, you have any points that you want to share with us about the issue and challenges faced by everybody now around the world pertaining to SARS-CoV-2?
Yeah. Thank you. I remember very distinctly when the COVID started in India, even prior to that, when China has reported the cases. The first thing which we was struggling to get the right tests within our arsenal, and then second was to prepare the laboratory. But in the meantime, we got the test, which is Apex laboratory in NIV, into laboratory, National Influenza Center and BSL-4. We were ready and we started screening the suspected cases. The next challenge, the way it started increasing in the number to enhance the laboratory preparedness. But in the meantime, there was a huge scare. If we invite these participants to the NIV, there was a chance that even training persons can infect it and it can spread in NIV. So there was no other option rather doing Zoom meeting and in training. So initially we choose those laboratories who are already trained. So we have a network of VRDL, which is Virus Research Diagnostic Laboratory of 126. And that has 3 layers of training program conducted in the past. And 25 of the laboratories is being highly trained in last 5 years to handle different kind of pathogen, including Nipah, Zika, yellow fever, and all emerging pathogen whenever there was a fear in the country. So we initially started with these 12 laboratory were widely trained and experienced in biosecurity mitigations and risk assessment. So they quickly, within 2 days, online training was done. Reagents were shared and they started training. Then the next step was coming up next 13 laboratory. But the challenges was after that, those laboratory where they were only doing ELISA screening, they were not equipped with sample handling, doing real-time PCR. Even they didn't have the machines. So government has took a lot of efforts and they started procuring these all the equipments. It was installed in these laboratory, and then there was a team exclusively put for following each and every day training. Training, not only the training, but sample and everything was done. But later on, when the samples started increasing and numbers gone in lakhs, and they have to screen a huge number of samples, we realized there was many laboratory who engaged newly. They started having contamination, and they were not knowing, and they started having people infected, and they were not knowing if they are getting infected in community, are there, because most of these laboratory stay in a hospital setting. So it was quite a struggling and challenging time, that you want to make sure safety of your laboratory workers, same time you want to do best services for the country. And then we realized, though we are doing these efforts for years, headquarters and ICMR and our laboratory is being engaged with the World Health Organization also, continuously training the laboratory. But a situation like pandemic, all these efforts become very minimum. So the lesson which we have realized with this pandemic, that we have to keep doing this exercise. We have to keep training the new staff. Even we should install these kind of training in not only graduations classes, but also postgraduates colleges, where the students are learning molecular biology or microbiology. They should be trained from the beginning. All the hospitals, medical colleges, the nursing officers, and all the health workers should be trained on every single aspect. We had this tough fight when we had Nipah outbreak in 2018, first time. And even we were not, the people were not trained how to do the burial of those people who are positive in Nipah cases. So those kind of challenges India is seeing from last 5 years, though we are doing the training, but it was not sufficient for a pandemic. The second challenge which we see in the laboratory capacity, if you have a BSL-2 laboratory, and if there is a high risk group of pathogen come, it is always less in number to deal with. And in beginning, you remember when COVID started, no one was able to decide what will be the biosafety level, because we were not knowing much about the pathogen and the disease. And we all know that when such unknown pathogen start, then we have to consider at highest level of the risk assessment. So initially, and so we have to pull all the capacity of all the structure of the country, that include Department of Biotechnology, Department CSIR, which is our scientific council, DST, ICMR, DRDO, defense laboratories, and all together, then we could deal with this crisis. So I think these has to be done on a very regular basis. And the third point, which I really felt that we need to build more and more containment facilities. People should be trained to work, and they should be able to train the new team, so that this pattern should keep continue. The fourth and the most important, that risk assessment is a quite rare field for most of the people, and very few people in the world actually know how to do right risk assessment, how to decide and how to do a stepwise risk assessment. So that is one emphasis India is doing for many years through our IBSC, the Biosafety Committee in each institute, and that pattern should be more, it should be taken up with the polio essential and eradication of other programs where we are going to eradicate certain diseases. This become more important to decide about the risk, decide about their biosafety level. So I'm very glad that you are invited in this session. But these are the 3-4 points which I feel should be considered whenever we are talking about the biosafety, and it become core of all these laboratories, medical facilities, and even in the vaccine manufacture, which we saw that if you are going to make a vaccine and you are having a high risk group of pathogen, you need to do the challenge study, preclinical study, and other which where you require these viruses. So we should also have such kind of studies where high animal studies can be done in the country. So these kind of I think understanding we need to have for the future coming up outbreaks, pandemic, so that we can do better and we can save life in advance rather losing so many near and dear ones like we did in pandemic. Thank you very much.
Thank you so much, Dr. Praga. And again, you have, re-emphasized the points, that we highlighted, again and again, in terms of facility, in terms of trainings and emergency preparedness and things like that. Thank you so much. Dr. Asad, I suppose we can, end these sessions and we have to come up with solutions.
Yes, that is in your hand, I think.
All right, so thank you so much. I try my best to capture all the points that we have discussed and summarize it. And now I would like to share with all of us the points that we have discussed and into a simpler way of understanding our points. So the issue and challenges that we face, I categorize it into 3 areas. The main area, of course, there are many things that we have discussed. The first one is a well-trained personnel, in terms of knowledge and also skills in handling all these, all these infectious agents and during this pandemic. So these are things that we need to have, in mind when we prepare ourselves for the future. So well-trained personnel or manpower. Yeah, we do have manpower, but they are not well trained. That's why they may have some limitation in terms of handling the samples the right way, like we mentioned just now, the QC, how we should ensure the QC is there when it comes to massive sample. The second point I would like to share here is that facilities and capacity, that is a must. We must have this in place to anticipate those, very infectious agents. If we do not have that facility, how could one handle all this? It is very critical that we must have that. And the third one is resources. We need a lot of fund to do all this, tackle all these problems. For example, like the PPE, we actually lacking of this PPE in the first phase that we're facing this, and we need to have huge amount of fund to get all this PPE ready for the pandemic management or handling, things like that. So besides funds that we need, like material, what Dr. Natasha has mentioned, we need all this, and due to the closures of this border, we can't really get this thing in times to handle all this. So we also have to think of, if we close down the border, how can we handle all this, and we need more supports in terms of material. So these are 3 things that I think that is can bring us to the attention and prepare ourselves for the future. And for the mitigation measures, there are 3 points here also I can capture. The first thing is a platform, sharing platforms. We must have platforms available for all of us to share the knowledge or any mistakes that we can actually learn from each other and make things better. So like associations or networking that we need to do through all these platforms, definitely will enhance our efficiency in terms of overcoming all these challenges and issues. Collaboration is a must among all of us. And the second one is regulation and guidelines. We must have all these regulation and guidelines in helping us to, when we talk about quarantines, talk about the vaccine developments, and of course, how we should actually handle the agent itself. So rules and regulations mainly pertaining to biosafety and biosecurity. And of course, not to forget about the terrorism, misconduct or misuse of these agents. So we must have all these guideline policy in place so that we can actually regulate it more effectively. And last but not least, training is a must. all panels has mentioned that training is a must so that you can enhance our competencies, of course, in terms of knowledge and skill. And of course, now we learn we learned about this SARS-CoV-2 is a new virus, and how about a newer coming out, perhaps 3 to 5 years or perhaps 10 years, things like that. And if they say it's more infectious, how can we handle it? If they say we need BSL-4, for example. So I think these are a few points that I could capture.